So my name is Dr. Omer Raheem. I'm a reproductive urologist at the University of Chicago. Oral TRT products, which stands for oral testosterone replacement treatment or oral testosterone supplements, has been emerging as a very effective and safe product for testosterone replacement therapy in the United States. This has been done after a major safety trial that has been approved by the FDA. So currently, and for the longest times, we didn't have any oral supplementation of testosterone. We depended on gels and pellets and injectables to deliver testosterone to our patients. But now currently we have a number of options for oral supplementation of testosterone and has been approved by the FDA in the United States to improve the patient's symptoms who often may come with lack of libido, erectile dysfunction, some physical and oftentimes metabolic problems as well, to improve their energy and libido and sexual function. So we're very pleased to see that, and currently we are at the conference here, the Sexual Medicine Society of North America, a meeting in San Diego this year, 2023. We have seen multiple papers and presentations delivering the safety and efficacy profile for these medications. So this is a very common question I get asked a lot by my patients when they see oral and they take probably a number of medications with them, maybe diabetes medication, maybe hypertension medication by the cardiologists and endocrine doctors. And they ask me as a urologist, doc, what does that interfere with other medications, for example? So my answer to that, or to them usually, is that there's no data we have to demonstrate interaction. Obviously you have to be safe and careful with your list of medications and run it by your doctors and make sure that your urologist actually gave you the oral testosterone therapy, which is a newer one in the market. Because remember, those medications are for the last probably a few years now in the market, and we've been giving it routinely for our patients as a very good, safe and easy pill to digest. But again, you really have to look at your medication list and make sure there's no interaction. But again, from what we know from the studies and trials done, safety trials done for these particular medications, there has been no major interaction between the oral TRTs, pills, and other medications. Typically, if you look at the package insert for this medication, the FDA approved each type of testosterone in different way of delivery. For example, some medications are taking once a day, sometimes twice a day. And each medication brand, if you will, has a different way of delivery or giving to the patient, administration mode, if you will. And you also have to be careful on what you're taking, what you're eating, for example. I can give you an example. For example, one medication needs to be taken with fatty meals. So, and that fat can actually help the medication get absorbed quicker through the gut, and it raises the concentration of the testosterone in the bloodstream, which has to be between the 300 and 1,000 level in that range, so that there's no, so that you can see the benefit of the drug. So medication has to be given with we call it fatty meals, if you could, trying to enhance the absorption of the testosterone in the body so that they get the benefit of the drug. Certainly, testosterone products are medications, and the FDA has been, careful in reporting these side effects. Usually, these side effects are minor side effects, mild in nature, but typically, the trial is done in these drugs. The oral testosterone products are focused on the major cardiovascular events, as well as liver toxicity or liver dysfunction, if you call it. And the last one on prostate health and PSA. These are the major 3 or 4 categories that the FDA looked at and has shown that to be safe. There's no major side effects or major cardiovascular side effects from taking these oral medications. Obviously, you're going to have to as a patient who's taking this medication, being checked regularly by your doctor, by your local urologist, who has to do like certain tasks and routine labs and examinations, which involve taking your blood counts, your liver function test, and your PSA as well as your testosterone levels, to ensure that you are not having any blood disorders that we call it polycythemia, where there's elevation in the hematocrit levels in the bloodstream and can lead to hypertension, other vascular problems, and leading to a major cardiovascular, which obviously we don't need to see that in our patients. And again, but the majority of the patients report very mild side effects. This has been proved by a large safety trials. And currently we have a TRAVERSE trial, which revealed really there's no major cardiovascular events in our patients, in our men who are taking those oral therapies.